Download this code from codegive.com, link in the description below. OK, let's dive into a comprehensive guide covering blood tests related to food allergies and oral food challenges, OFCs. This will be a detailed explanation, including the principles behind the tests, how they're interpreted, and the process involved in an OFC. While a true code example isn't applicable for medical procedures, I can provide illustrative code snippets in Python to demonstrate data analysis and visualization you might encounter when working with blood test results or OFC data. Part 1, Blood tests for food allergies. Blood tests for food allergies are primarily screening tools. They detect the presence and quantity of specific IgE, immunoglobulin E, antibodies in your blood. IgE antibodies are produced by your immune system in response to allergens. When you are exposed to an allergen, your body will produce IgE antibodies specific to that allergen. They do not definitively diagnose a food allergy on their own. A positive blood test simply means you've been sensitized to that food, meaning your body has recognized it and produced IgE antibodies. Clinical context and symptoms are crucial for interpreting the results. 1.1 Types of blood tests Asterisk specific IgE, SIgE, blood test, RAS/immunocap. This is the most common type of blood test for food allergies. It measures the level of IgE antibodies specific to particular food allergens, example peanut, milk, egg, wheat, soy, tree nuts, shellfish. Asterisk how it works. Asterisk a blood sample is drawn and sent to a lab. In the lab, the blood sample is exposed to different food allergens. If IgE antibodies specific to a particular food are present, they will bind to the allergen. A process then quantifies the amount of IgE bound. The result is reported as a concentration, Q/L or IU/ml. Some labs also report results using a class system. Asterisk reporting. Asterisk quantitative. Results are typically reported as Q/L or IU/ml. A higher number generally indicates a greater degree of sensitization, but it's not a direct correlation with the severity of allergic reactions. Qualitative, class. Some labs use a class system, example class 0 to class 6, where higher classes correspond to higher IgE levels. Component resolved diagnostics, CRD. This more advanced testing method measures IgE to individual protein components within a food. It can help differentiate between true food allergies and cross-reactivity with pollen or other environmental allergens. How it works. Instead of testing against a whole food extract, CRD tests against individual proteins from that food. For example, instead of testing against peanut, CRD might test against ERA H1, ERA H2, ERA H3, ERA H6, and ERA H9, major proteins found in peanuts. Benefits. Improved risk assessment. Some proteins, example ERA H2 in peanuts, GAL-D1 in egg white, are more strongly associated with severe allergic reactions. IgE to these proteins may suggest a higher risk of anaphylaxis. Distinguishing true allergy from cross-reactivity. Certain proteins, example BET-V1 homologous proteins, are found in both foods and pollen. If a patient has IgE to a BET-V1 homologous protein in apple, they might be reacting to birch pollen cross-reactivity rather than a true apple allergy. They might tolerate cooked apple. Guiding management. CRD can help determine if a patient might tolerate baked or processed forms of a food, example extensively heated milk or egg. Basophil activation test, BAT. This is a more specialized test that measures the activation of basophils, a type of white blood cell, in response to food allergens. Asterisk how it works. Asterisk a blood sample is incubated with different food allergens. If the patient is allergic, the basophils will be activated and release certain markers, example CD63, CD203C, on their surface. The degree of activation is measured using flow cytometry. Asterisk benefits. Asterisk improved diagnostic accuracy. Asterisk BAT is considered more accurate than SIgE tests in some situations, particularly for diagnosing food allergies in patients with borderline SIgE levels. Asterisk monitoring treatment. Asterisk BAT can be used to monitor the effectiveness of oral immunotherapy, OIT. Asterisk limitations. Asterisk BAT is more expensive and complex than SIgE testing. It is not as widely available. 1.2 Interpreting blood test results. Asterisk interpreting blood test results is best done by an allergist or qualified healthcare professional. Here's a general overview. Asterisk negative result. Asterisk a negative SIgE result generally indicates that the patient is not sensitized to that food. However, a negative result does not completely rule out a food allergy, especially if there is a strong clinical suspicion, history of allergic reactions. Asterisk positive result. Asterisk a positive SIgE result indicates sensitization. The higher the SIgE level, the more likely the patient is to be allergic, but there is no absolute cutoff value. Asterisk factors affecting interpretation. Asterisk age. Asterisk SIgE levels may be lower in infants and young children. Asterisk history of allergic reactions. Asterisk a history of allergic reactions increases the likelihood that a positive SIgE result represents a true food allergy. Asterisk cross-reactivity. Asterisk as mentioned earlier, cross-reactivity with pollen or other allergens can lead to false positive SIgE results. Asterisk local lab variations. Asterisk different labs may use different assays and reporting methods, so it's important to compare results to the lab's reference ranges. 1.3 Limitations of blood tests. Asterisk sensitization versus allergy. Asterisk blood tests detect sensitization, not necessarily clinical allergy. Many people can have positive SIgE tests without experiencing allergic symptoms when they eat the food. Asterisk false positives. Asterisk cross-reactivity and other factors can lead to false positive results. Asterisk false negatives. Asterisk blood tests can sometimes be falsely negative, especially if the allergy is mild or intermittent. Asterisk predicting severity. Asterisk SIgE levels do not always correlate with the severity of allergic reactions. Asterisk not diagnostic on their own. Asterisk blood tests should always be interpreted in conjunction with a patient's clinical history and physical examination. Illustrative Python code, data analysis and visualization. This is an example of how you might use Python and libraries like Pandas and Matplotlib to analyze and visualize food allergy blood test data. Remember, this is not medical diagnosis software but rather an example of how to handle and represent data. Explanation of the Python code. Asterisk 1. Import libraries. Asterisk import Pandas for data manipulation and Matplotlib for visualization. 2. Sample data. Asterisk create a sample Pandas data frame. Replace this with your actual patient data. The data includes asterisk patient ID, unique identifier for each patient. Asterisk allergen, the food allergen being tested. Asterisk IgE_Q_L, the specific IgE level in Q/L. Asterisk symptoms, whether or not the patient has reported symptoms when consuming the food. This is crucial for clinical context. 3. Define cutoff values. Asterisk define example cutoff values for different allergens. These cutoff values should come from the lab that performed the tests and may vary. 4. Add cutoff indicator. Asterisk add a new column called above_cutoff to the data frame. This column will be true if the IgE level for a particular allergen is above the defined cutoff value and false otherwise. The function applies a different cutoff depending on which allergen is being tested. 5 bar chart * create a bar chart visualizing the IgE levels for each allergen. 6 scatter plot * creates a scatter plot showing the relationship between IgE level and whether the patient reported symptoms to the allergen. Important notes about the code *. Real data * you must replace the sample data with your actual data. Cutoff values * use the correct cutoff values provided by the lab that performed the blood tests. Data cleaning * real-world data often requires cleaning and pre-processing, handling missing values, correcting errors, etc. Statistical analysis * you can extend this code to perform statistical analysis, example correlation analysis, to explore the relationship between IgE levels and clinical outcomes. Part 2, Oral Food Challenge, OFC. An oral food challenge, OFC, is the gold standard for diagnosing food allergies. It involves gradually introducing a suspected allergenic food under medical supervision to see if a reaction occurs. It is used to confirm or rule out a food allergy, and is the only definitive way to diagnose a food allergy. 2.1 Indications for an OFC * to diagnose food allergy * to confirm a food allergy when the history and blood test results are inconclusive or conflicting. To determine tolerance * to determine if a child has outgrown a food allergy. Many children with milk or egg allergies, for example, will develop tolerance over time. To assess cross-reactivity * to evaluate if a patient who is allergic to one food is also allergic to a related food. To reintroduce foods to reintroduce foods that have been previously avoided due to suspected allergy, especially when the suspicion is low. 2.2 Contraindications for an OFC * severe uncontrolled asthma asthma should be well controlled before an OFC. Acute illness the patient should be healthy and not have any acute illnesses, example cold, flu. Recent allergic reaction an OFC should be postponed if the patient has had a recent allergic reaction, within the past 2 to 4 weeks. Eosinophilic esophagitis, EOE if EOE is suspected, an OFC may need to be carefully considered or performed with additional monitoring. Severe anaphylaxis a history of severe anaphylaxis to the food in question may be a relative contraindication, and the OFC should be carefully considered and performed with extra precautions. 2.3 Preparation for an OFC * medical history and physical exam * a thorough medical history and physical examination are essential. Medication review * certain medications, example antihistamines, may need to be withheld before the OFC discuss with the allergist. Informed consent * the patient, or parent/guardian, must be fully informed about the risks and benefits of the OFC and sign an informed consent form. Emergency medications * epinephrine auto-injectors and other emergency medications must be readily available. For access, sometimes depending on the patient's risk factors and the food being challenged, for access may be established before the OFC. 2.4 OFC Protocol * the specific protocol for an OFC may vary depending on the food being challenged, the patient's age, and the allergist's preferences, but the general principles are the same. 1 Initial dose * the OFC typically starts with a very small dose of the food, example a few milligrams of peanut protein. 2 Gradual increase * the dose is gradually increased at regular intervals, example every 15 to 30 minutes, if no symptoms develop. 3. Observation period * the patient is observed for several hours after the last dose to monitor for delayed reactions. 4. Cumulative dose * the goal is to reach a predetermined cumulative dose of the food. The cumulative dose is the total amount of the food consumed during the challenge. 5. Monitoring for symptoms * the patient is closely monitored for any signs or symptoms of an allergic reaction, such as skin hives, itching, flushing, swelling. Respiratory * wheezing, coughing, shortness of breath, runny nose. Gastrointestinal * nausea, vomiting, diarrhea, abdominal pain. Cardiovascular * dizziness, lightheadedness, drop in blood pressure. Systemic * anaphylaxis, a severe, life-threatening allergic reaction. 6. Management of reactions * if an allergic reaction occurs, the OFC is stopped immediately. The patient is treated with appropriate medications, example antihistamines, epinephrine. 7. Positive OFC * a positive OFC means that the patient experienced an allergic reaction during the challenge, confirming the food allergy. 8. Negative OFC * a negative OFC means that the patient tolerated the food without any allergic symptoms, ruling out the food allergy. 2.5 Interpretation of OFC results *. Positive OFC * confirms the food allergy. The patient should continue to avoid the food. The allergist will provide guidance on how to manage future exposures and what to do in case of accidental ingestion. Negative OFC * rules out the food allergy. The patient can safely consume the food. The allergist may recommend gradually introducing the food into the diet. Unclear result * in some cases, the results of an OFC may be unclear. This can happen if the patient experiences mild or ambiguous symptoms. In such cases, the allergist may recommend repeating the OFC at a later time or performing additional testing. Illustrative Python code, OFC data management. While not directly controlling the OFC process, Python can be used to track dosages, record symptoms, and analyze the data. Explanation of the OFC Python code * 1. Data representation * the OFC data is represented as a pandas data frame. Columns include time elapsed since the start of the OFC. Dose_mg, the amount of the food given at that time point, in milligrams. Cumulative_mg, the total amount of the food consumed up to that time point. Symptoms, any symptoms reported by the patient. Medication, medications administered. 2. Analysis * the code includes simple examples of data analysis. Find the time of the first reported symptom. Find the maximum cumulative dose tolerated. 3. Replace data, use data from a real OFC. Important considerations *. Clinical judgment * the interpretation of OFC results is always based on clinical judgment, not just on the data alone. Safety * OFCs should only be performed by trained medical professionals in a setting where emergency care is available. In conclusion blood tests and oral food challenges are important tools for diagnosing and managing food allergies. Blood tests are primarily screening tools that detect sensitization to food allergens. Oral food challenges are the gold standard for confirming or ruling out a food allergy. Always consult with a qualified allergist for proper diagnosis and management of food allergies. The example code snippets illustrate how you might use Python to analyze and visualize data related to blood tests and OFCs, but they should not be used for medical decision-making.